Now up towards you. And down again, really hard. Come on. Curl, 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 curl. Great. Do this one. Curl as hard as you can. Up and down as hard as you can. Great. Bend your knees and put your toes off the edge of the table. And curl your toes to grab the table. Try to grab the table. Awesome. Really good. Does it hurt?
A little bit. It's still kind of sore, but...
That's okay. That's really good.
Okay.
There are a bunch of things that I'm looking for at this point.
Mm-hmm.
One is I'm looking at the position of the bone. Is it in this position that we still want it to be?
Mm-hmm.
Are you healing at the appropriate rate for your age? Are you swelling properly in terms of where you are in the recovery process? Everything's checking out perfectly. It takes bone 8 to 10 weeks to go through what is called the first phase of bone healing. There are multiple phases of bone healing. When you get through that first phase of bone healing, swelling goes down, comfort improves, range of motion improves as well. Now, given how swollen you are right now, you're not very swollen. You might be finishing that first phase of bone healing sooner than most, but you're a bit younger than the average person that gets their bunions corrected. Now that you're completing the first phase of bone healing, we can take a big step forward in your recovery. You don't have to be in gym shoes all the time now.
Awesome.
You can return to other types of shoes. Now, you're not going to necessarily just go from gym shoes to like the cutest shoes all at once.
Okay.
The way I want you to go through that is first thing in the morning before you've had any swelling for the day, go ahead and put on some pair of shoes that you'd rather be wearing than gym shoes. If you can get it on your foot, terrific. If you try and you say, oh, it's just too tight, I can't do it yet, that's okay. Wait 2 or 3 days and try again. And try every 2 or 3 days until you can get it on. 2 or 3 days may make a huge difference. Now, given what I'm seeing today, you'll probably be able to get something on tomorrow. When you do get your shoes back on, you'll only be able to wear them for maybe 2 or 3 hours before you feel like, okay, they're getting too tight. I'm going to go back to my gym shoes now. And little by little, day by day, you can start to wear those shoes longer and longer and longer. And you can start to put on any shoe you want that has a little bit of support. High heels are okay.
Wow.
Anything you want. I still want some support for the next month. Exercise, are you wanting to do some exercise?
Yeah.
All right, so you can go back to yoga as much as you want.
I can do like up on my toes.
Yeah, you might not be able to. I mean, you might get back to yoga and there might be certain positions that you're like, yeah, I can't do yet. But you can go ahead and try. You won't hurt anything by trying. Walking on a treadmill, what I'd like you to do is at the beginning, your first day back on a treadmill, it might be today or tomorrow, spend no more than 15 minutes on the treadmill.
Okay.
Get off no matter how good you feel at a reasonable speed. Then take a day off and then do 15 minutes again. So you're only going to go every other day, and every 2 times you can increase by 5 minutes.
Oh, okay. And then what about running? That's not
running, once you pass 30 minutes of walking, you can do running.
So the pins are not going anywhere. Those are in for life, right? I think I asked you that before.
Almost certainly. Not 100%, but almost certainly.
Okay, they don't dissolve or anything.
They don't.
They're not, I'm not going to, like, nothing's going to happen where I'm going to dislocate them or anything like that. They're in there. Okay.
No. Yeah, so what I would do, once you're done with this round of therapy, I would still go once a month for a while, just to make sure that you're keeping up with the things that you should be doing. Okay?
That's it. That's all I wanted to know.
Well, as much as you like your feet right now, they're not even close to being
Oh, I know.
down.
I tried to try my high heels on this weekend just to try, and they don't fit yet. And I know they fit before.
So you're probably almost 50% healed.
Okay.
So if you imagine the first 2 months takes 50%, the next 3 or 4 months takes the next 50%. So you're doing great, but there's still a lot of better that's going to happen.
Okay. Yeah, I know. I can't wait. I can't wait to go running in the lake. That's all I'm looking forward to. Just getting back into like doing things I haven't been able to do, you know. So.
That's awesome.
Yeah, they look great. I cried when they took the bandages off. I couldn't believe it. Yeah, and they feel good. Like it feels good to walk. Besides this,
Put them together.
which is unbelievable.
So, Christina, it's 6 months past your surgery. So just wanted to check in and see how you're feeling about everything and how your experience was versus what you expected it to be.
Sure, I actually feel great. I could not be happier that I did this surgery. My life has dramatically changed for the better. I went from not being able to walk down the street, being in really bad pain every day, not being able to do certain exercises, to being able to do everything again, and it feels great. And I'm so happy I did this surgery.
So was it as scary as you thought? Because I know that you were really anxious prior to surgery.
Obviously, every surgery is going to be kind of scary because you don't know what to expect, but everybody at the office here at Dr. Weil's made everything so much easier and nicer, and everybody really just made the experience kind of flawless. I was actually out of here right away after my surgery, which you don't expect to do that, but I was literally back at home on my couch, a couple hours afterwards, so that was kind of nice.
Awesome. And are you getting a chance to wear the shoes that you weren't able to wear before surgery?
Absolutely. I actually just went to my cousin's wedding on Saturday, and I wear high heels for the first time in years. And
Seriously?
I literally was walking around in high heels, so that was nice. 'Cause that was something I haven't done for years. Swelling has been gone. The swelling's completely gone, and it's kind of interesting to watch how your feet change over time, and they actually just keep looking better and better, like as further out you get from the surgery. So, that's no swelling whatsoever.
No
So,
swelling, some discomfort at the end of the day still?
a little bit of discomfort just because of I think something else that I have going on with my foot. But as far as like the bunion surgery, totally different, total change. And not to mention, you can't even see my scars either. So that's really nice.
Awesome. All right. Well, we're going to check back in with you in a year. And there still is a lot of, well, not a lot, but some subtle healing that'll take place over the next 6 months. So you'll still see some changes.
Oh wow. Okay.
Yeah. All right. Thanks.
Thank you.